If you are experiencing pain on the inside of your shin, then it could be something like shin splints. Now, shin splints is a really horrible condition and a really painful one. So in today's video, I'm going to explain everything you need to know about shin splints and what you can do to get yourself out of pain and back to the exercises that you were doing before. Now, shin splints is more commonly affecting people who are doing running or running sports. So in about 35% of runners, they will experience shin splints at some point throughout their running career, or people who do running sports or jumping or anything that just involves excessive use of the lower legs. Now, shin splints, as I just said, is a very common condition and very painful. So in order to fully understand what shin splints are, let's have a look at some anatomy. So here we have a model of a left leg. So looking at it from the inside, so this is the inside of your left leg. This is your shin bone just here, and attaching just behind that are a group of muscles. So in shin splints, we tend to find that it's very painful on this kind of middle third of the shin bone. Above that doesn't tend to really cause that much pain, or right down by the ankle doesn't also cause that much pain. But pressing anywhere on this middle third of the shin bone is usually very painful. So looking at the anatomy, what we've got here is some muscles that attach just on this part of the shin bone. So there's two main muscles that attach. The first and the biggest is the soleus. Now you can't really see it that well, but you can kind of see it. So looking at the leg from the back, you've got the gastrocnemius, which is this muscle that has the two heart-shaped heads. And then it's got the tendon that comes down and attaches to the heel. Underneath that, and you can kind of see it, is the soleus. So it's just here. And then on the outside, just down here as well. If I take this compartment off, you can see how much the soleus takes up of the leg. So it doesn't attach above the knee. So it attaches sort of to the top third of the shin bone. And then it comes all the way down and again attaches to the heel. Looking at the leg, so we've taken away the calf, we've got the flexor digitorum longus, which also attaches to the backside of this shin or shin bone. So essentially, shin splints is pain that's caused by increased load or increased repetition through the muscles and pulling on the bone. Now on the bone, we have a lining called the periosteum. Now the periosteum is like a sheath. So if you imagine an electrical wire, and inside that you've got the copper wire that goes through, and then around that you've got the insulation, which is the sheath. So bone is very much similar to that. So you've got the bone, and then around that is the periosteum. Now the periosteum kind of attaches the muscles to the bone. Now, if there's increased repetition or increased force going through the muscle and onto the bone, then sometimes that can irritate that periosteum, and that can cause inflammation and that can cause pain. Now, in the case of shin splints, where there's excessive repetition or excessive force going through these muscles, that can often cause pain and inflammation around this area. So it's very much a condition of too much too soon. So people who have just taken up running, people who have also increased the frequency of their training, or in perhaps people who have gained weight and so there's excessive force going through the muscles in order to make them move. Now, another thing worth considering is, could this pain be coming from or could be caused by something like poor foot mechanics? So maybe you've got a dropped arch or poor stability in the foot or ankle. So that could be causing rotation through the leg. Or could it be something like poor gluteal strength? So maybe your glutes are not working efficiently, and that's causing a rotation going through your thigh and therefore putting excessive strain through your knee and your shin. So what I would suggest is going to get yourself assessed by someone who can look at you biomechanically. Maybe they can figure out a few things that's causing your pain. Now with shin splints, unfortunately, unless you stop what you're doing, it could potentially get worse. Now when I was at school, I had shin splints in both shins. At the time, it wasn't very well diagnosed, and I wasn't given a really good plan of what to do. So I just carried on training, carried on playing sport, and it got worse and worse and worse to the point where I couldn't really walk, and it's difficult for me walking to and from lessons. So in the end, what I had to do was just give up all running sports and just focused on swimming all year round. And it took me years before I had the courage to take up running again. Thankfully now it's fine, but I don't want you to go through that. So I want you to get yourself a lot better, a lot quicker than what it took me to get better. So in your case, if you're feeling pain on the inside of your shin, my suggestion would be to stop doing whatever it is that you're doing, especially anything that's aggravating the pain. So if you're running, then you have to stop running. So what we're going to do is we're going to work through 3 phases. The first phase is all about reducing pain and inflammation. The second is all about restoring flexibility and mobility. And then the third phase is about rebuilding strength and stability. Now, this is something I go into in a lot more detail in my free ebook, which you can download using the link in the description below. But if you are right now experiencing pain, then you're probably in phase 1. Now, phase 1 is all about reducing inflammation and pain. So to do that, what we need to do is stop the exercise or stop the activity that's making the pain worse. That doesn't mean you just stop all movement. Movement is key. So you have to keep moving, but just not anything that's going to cause more irritation. So if you're running, then perhaps take up cycling or swimming or rowing. Keep yourself moving. Gentle massage will also help to reduce some of that inflammation. And I say gentle because if you go to someone who's like a sports massage therapist and they go too hard, then that can also cause more irritation. So if you do go to see someone, make sure it's very gentle, just enough to get blood moving through the muscle. Now there's going to be some degree of inflammation, so we're going to need to use ice. So cool the area, reduce the inflammation. If you can handle it, then ibuprofen or some other anti-inflammatory. That's not a prescription. Go and speak to a pharmacist or a doctor. But some kind of anti-inflammatory may help to reduce that inflammation. Once we've done this for a period of time, then we can move into phase 2, which is restoring the flexibility and mobility. And I'm going to show you some really simple stretches that you can do right now. Okay, so once your pain is down to around a 5 or a 4 out of 10, it's now time to start using things like foam rollers. The purpose of using a foam roller is to help to release some of those tight adhesive knots within the muscles. So we're going to roll on the soleus primarily, and bearing in mind that the attachment points that are causing pain are on the inside here. So we're going to mainly focus on rolling the inside. Now the reason why we're going to do this in conjunction with stretching is because imagine you've got a length of elastic, and if you tie some knots in the elastic and then you stretch it, the whole length is going to still stretch, but those knots are still going to be there. So when you're stretching, all you're going to do is lengthen the entirety of the muscle. And then when you add in some foam rolling, you're going to help to break down some of those tight points within the muscles as well. So get yourself on the roller, and you're going to put one foot on the floor. The leg that you want to focus on is going to go on the roller. Hands go down by your sides. And you're just going to lift yourself off slightly off the floor and move along the roller, looking for tender points. So you want to go on the inside of your calf, you want to go in the middle and on the outside as well. It won't hurt to do the outside, but mainly focus on the inside. So roll along, look for tender points. When you find one, just rest on that point. So don't go rolling up and down because that's not going to do you any good. So when you find those tender points, just press and hold. Try and relax your foot, try and relax your ankle, and just wait on that point for about 30 seconds. What you could also do is just slightly roll off and very slightly roll back on. And as you do this, as you roll off, it should get slightly less painful. As you roll on, the pain should just slightly increase. And if you keep doing that, eventually, as you do this, you're rolling a bit further each time, eventually you'll kind of go past that tender point and move on to another one. So we're going to do that, and we're going to work all the way along the sort of entire length of that soleus muscle. So you don't need to go all the way up to the knee, but about 2/3 of the way is fine. If that's okay for you and you're not feeling that it's doing anything at all, what you can do is cross one leg over onto the other. So this was going to add some extra weight, and actually you'll probably find this is a lot more painful. So again, same thing, just move along, find those tender points. When you find a tender point, you can relax, so you don't have to keep your weight suspended off the floor, but just press down, work into that muscle, roll off, work in, and roll off, and just keep working those tender points. The more tender and the more painful this is, the more it shows you need to do it. But when it comes to foam rolling, what I would suggest is you don't do this every day. So I would say every other day or every 2 days should be fine. Now, to effectively stretch your soleus muscle, it's a very simple calf stretch. Quite often you'll see people stretching their calf with a straight leg. Now this is fine, but this is also going to be stretching your gastrocnemius. So to take out the gastrocnemius, what we're going to do is get yourself into a calf stretch position. So the leg you want to stretch is at the back. Find something you can press against or stabilize against. And then from here, instead of keeping your leg straight, bend your knee. Try and push your knee down towards the ground. So immediately, instead of feeling the stretch up towards the top, you should start feeling the stretch down towards the middle third of the calf. So bend that knee, keep your heel on the floor, and press down with the knee and hold. Now you can do this for anywhere between 30 to 60 seconds, and you can repeat that several times if you want to. Again, if it causes you pain or seems to make your problem worse, then just stop or just reduce the intensity or the frequency. So once you've gone through a period of stretching and foam rolling, hopefully now the pain has come down even more. So hopefully now it's around a 4 or a 3, maybe even a 2. So phase 2, the stretching, the flexibility, mobility, can take several months. So be patient with that, don't rush it. But the next phase we're going to go into is phase 3, which is to strengthen the calf muscles, or particularly the soleus. So what we're going to do is just one simple exercise. That's all you really need. Don't overcomplicate it. And if you do, you'll end up doing too much and then you'll get bored and then you won't go through this phase. So the first thing we want to do is to find just a flat floor and bend your knees, hold on to something just for stability. And with 2 legs, you're going to lift your heels off the floor. Pause at the top and very slowly down. It's very important to go slow on the way down. No matter how slow you think you're going, go slower. Up, pause, and down slow. Up, pause, and down slow. We're doing this with a bent leg, so we take out part of the action of the gastrocnemius. So it mainly focuses more on the soleus muscle, which is the one that's causing us all of the problems. So it's going to help get that one more specifically stronger. So we start with 2 legs. If you find that is quite easy, what you can then do is take 1 foot off the floor and do the same thing. So sticking with a bent leg, lift up, pause, and down slow. Up, pause, and down slow. The reason why we're doing this on a flat floor to start with is so we take away excessive range. So we're not getting so much stretch going through the soleus. But once you've done that for a period of time, what you can then do is come up to a step. So now we can add more range. So again, we're going to go back to doing 2 legs to start with. Again, holding onto something, drop yourself all the way down, keep your knees bent. Come up, keeping the knees bent, pause at the top. And slowly all the way down. Try and feel a bit of a stretch going through the calves as you come all the way down. Really important to come as low down as you can. Up, pause, and down slow. Again, if that is too easy, then what you can do is take away 1 leg and keeping the knee, I'll do it with this leg. So take away 1 leg, keeping the knee bent, drop yourself all the way down as much as you can, and then all the way up, pause at the top, and then slowly all the way back down. If you find that doing it with one leg is too hard, but doing it with two legs is too easy, then what you can do is use two legs to come up, take away one leg at the top, and then lower yourself down again as slow as you can, keeping that knee bent. Then put the other leg back on, push yourself back up, pause, take the leg away, and down slow. I'll do that one more time. Put the leg on the step, help yourself up using both, take away one leg, and down nice and slow. So what we're working on that one is what's called the eccentric phase of contraction. So the muscle is lengthening while under load. So it's controlling you down. So you should be able to control that, and you might not have the strength to come up, but you should have enough strength to come all the way down. So we've got three different variations there. We've got the floor, flat, then we've got the step, and then we've got the eccentric type. So choose whichever one you find is the most appropriate. Of course, you've got two legs and you've got one leg. So I would suggest you start with two on the floor. Once you've done that, and that's okay, then you go onto one leg, do that on the floor. Then you progress to the step with two legs. Then you maybe progress to the eccentric single leg. And then last, you progress to the single leg all the way down and all the way up. I would do 10 repetitions, make sure they're slow, make sure there's a pause at the top and at the bottom. That shows that you're in control. So you're not just dropping down. So you're making use of the full muscle contraction. 10 repetitions, and I would then rest, and then I would repeat again, another 10, and then repeat again, another 10. Now, if this is the first week or 2 weeks that you're doing this, I would just start with one set of 10. Then I would not do this the next day. So I would do this every other day or every 2 days. You might find that because you're new into re-strengthening your calf muscle, this may make you quite sore. So I would do every other day, so it gives your muscles a chance to recover. This phase can last anywhere from a month to maybe 3 months. So now we've been through the three phases. What I want you to also consider is that there are other things that could be causing the pain. Firstly, it could be something like a stress fracture. So if there's quite specific pain on a certain point, then it's worth going to get that checked out. Or it could be something like compartment syndrome, where the tissues are expanding more than the fascia around it can adapt. So either way, go and get yourself assessed and get a diagnosis by a trained professional before you do anything else to try and treat it yourself. But now that we've gone through all of that, hopefully you've got a really good understanding of what could be causing your shin splints and what you can do to fix it. Now, a full recovery could potentially take 3 to 6 months. So the more you are focused on improving this and the more you are focused on doing everything the right way, potentially the quicker this could get better. If you ignore it and just try to run it off, I guarantee you it's probably going to get worse. So definitely follow the advice in this video. If this video has helped you, then give it a thumbs up. Let me know in the comments section below what phase you are in and what you are doing to help yourself get out of pain. If there's anything that you feel like I've missed, then please also let me know in the comments section below.